Weight loss drug craze could hit American taxpayers' pockets.
Americans spent over $50 billion on weight loss drugs like Ozempic and Wegovy.
This is a market and a class of drugs that could be targeted at half the population.
In 2020, these drugs accounted for just 1% of the bill for America's largest companies. Today, that number has exploded to over 20%. We're witnessing the biggest drug launch in human history. But behind the success of these miracle weight loss drugs, we've got a new problem, one that the United States was not built to handle. In this video, we're gonna look at the business of GLP-1 drugs like Ozempic, Wegovy, and others, and how they can be worth the money, they can work exactly as promised, and still push American healthcare into a corner that it might not be able to escape. Let's dive in. For nearly a century, American healthcare has worked off the premise that expensive treatments were meant for very rare diseases. Insurance models have essentially been built to absorb $1 million price tag for a rare genetic disorder or a six-figure bill for a specialized cancer treatment from time to time. It could afford those costs because the number of people who needed them, or the ones who got approved, was tiny. But GLP-1 drugs like Ozempic, Wegovy, and Zepbound have shattered this rule. These drugs are the first effective pharmacological answer to weight loss after decades of very dangerous failures. For example, in the 1950s, doctors thought they finally found the cure to weight loss. It came in the form of newer drugs like one called dexedrine. Doctors prescribed this drug to tons of people, and it worked. People lost weight and they actually kept that weight off. It appeared to be a miracle, until they found out that it was basically pharmaceutical grade speed. Doctors had found a very dangerous fix for weight loss, and they had accidentally triggered a national addiction crisis. Those lost pounds were just replaced by a wave of heart failure and psychosis that eventually forced the medical community to pull back. The next big effort in the 90s wasn't much better. The drug was pulled from the market after it was linked to fatal heart valve damage and a massive wave of legal settlements. So compared to those drugs, GLP-1s are a miracle. They work by enhancing insulin secretion, slowing down your digestion, and more importantly, regulating your brain's appetite signals. However, here's the problem. Employer health insurance only works when expensive treatments are rare. GLP-1 drugs only work when millions of people stay on them for life. GLP-1 drugs cost roughly $900 to $1,200 per month. Apply that to 40% of US adults classified as obese, and this is about to get ridiculous. We're moving toward a system where more than 1 out of every $5 spent on any medication in the United States goes to weight loss drugs. And it's creating a crisis because everybody's playing hot potato for who pays for the drug. But before we get into that, why do these drugs cost this much anyway? The nonprofit organization Doctors Without Borders found that making GLP-1s like Ozempic only costs anywhere between 89 cents and $4.73 for a month's supply. But most drug companies are charging over $1,000 a month before rebates. Why? Well, many drug manufacturers would say that the sticker price reflects the $5 billion they spent on research and development just in the last year, the losses they took for the failed drugs that didn't even make it to market before Ozempic, and the $6 billion currently being invested to scale production to meet the growing demand for these drugs. They'd also likely claim that 75% of their gross earnings are paid back in rebates and discounts to lower patient costs. And they probably wouldn't say this last one publicly, but they have a patent that expires in 2032 for this drug. So once that patent expires, the drug costs are going to go way down, so they're getting their money's worth while they can. But on the other end of the spectrum, it's hard to say that drug companies like Novo Nordisk haven't benefited immensely from this situation. Ozempic to Denmark is essentially what oil is to Saudi Arabia. The drug's success is so massive that effectively propped up the entire Danish economy last year, accounting for nearly 50% of the country's total GDP growth. Still, the company's immense gains haven't translated into an affordable option for those who bear the financial burden, typically companies. Drug makers argue that GLP-1s pay for themselves. Basically, invest the money right now and your employees will be healthier. They won't have as many heart attacks or disease later in life. But this logic isn't actually bulletproof. Even when 2 employees at Novo Nordisk designed a study to prove that their drug would pay for itself, their own results showed that the medication actually costs thousands of dollars more per person than it saves in medical bills. Furthermore, independent researchers presented data to the American Diabetes Association in 2025, showing that using these drugs for prevention costs roughly $289,000 for every healthy year of life gained, which is nearly triple the price point the medical community usually considers a fair value. What's more interesting, the National Pricing Watchdog calculated that the drug is technically a good deal for an individual because its price is lower than the $16,000 health value it provides in heart attack prevention. However, they simultaneously warned that covering a whole workforce would bankrupt the entire US healthcare system, creating a financial trap where the medication is technically worth it for the individual, but a financial impossibility for a company to offer to all of their employees. And there's another issue too, one that can make this drug completely worthless. There's currently a gap between how these drugs work and how people are using them. So far, drug makers have sold these drugs as lifetime medications. They only pay for themselves if you stay on them forever. But in the real world, people are quitting. A study from Evernorth found that over 50% of patients stop taking GLP-1s within a year. Here's why that's important. When a person stops taking the drug, the food alarm basically comes back. The weight will rebound, and the long-term health savings, the heart attack prevention we talked about, it basically vanishes. So companies are left paying specialty tier pricing for drugs that basically for many become a lifestyle jumpstart. And yet for drug companies, this is just their opening act. They look like they're starting to follow the Humira playbook. Humira became the best-selling drug in history by starting as a treatment for one thing and then getting approved for dozens of others, generating over $200 billion in that process. GLP-1s are just starting to do the same thing. We've already seen them move from diabetes to obesity. Now they're being approved for sleep apnea and heart disease, with trials underway for Alzheimer's and even addiction. The industry sees a $100 billion annual market on the horizon. But for those who actually have to pay the bill, there's going to be a breaking point here soon. It's not that many companies don't want to invest in happy and healthy employees. It's that right now, through GLP-1s, it's a financial impossibility. Over the last few decades, our healthcare system stayed afloat because we used expensive drugs to treat the few. But now rare disease prices is being applied to an almost half the population reality. If we can't bridge the gap between a $5 production fee and a $1,000 price tag, we might end up with the ultimate irony. A good deal for your health on the individual level, but a financial impossibility for a company to cover. If you found this video interesting, you'd like to see more like it in the future, please consider subscribing for more. This is Tyler Dutchover. Thanks for watching.